I'm Dushyant Sahani, professor of radiology. I'll share with you how I use spectral CT to assess patients with chronic liver disease. In the chronic liver disease setting, we have a objective to evaluate if there are liver lesions, both and in liver we can have both benign and malignant lesions. Our concern is to detect those malignant lesions that might require early intervention. We also have to do a comprehensive assessment for additional findings, and I will discuss that with you. The hanging protocol I prefer in the setting of chronic liver disease is I get the axial arterial phase monochromatic images reconstructed at the soft tissue kernel using 55 keV. I have a coronal images on the top right. These are also reconstructed at 55 keV in the soft tissue kernel. On the bottom left, I have the material density iodine images, and I will emphasize as we go through image the value of these images in very specific areas. And then I also have a material density water or a virtual unenhanced images here on my right. So let's start from the top of the liver. Here on the monochromatic images, we see a very good contrast in the vascular structures in comparison to the liver parenchyma. We go down and we start looking at a right lobe of liver that is an abnormality. It's enhancing greater than liver parenchyma. We come down, we observe there is a lesion with a lot of heterogeneity. That is, the central aspect of the lesion is low density. As we go down further, we realize this is greater than 3 centimeter lesion. I want to look at the relationship of this lesion to the vascular structures in the vicinity, that is the portal vein, to ensure it's not invading in the portal vein because that impacts patient management. What I noticed in the portal vein as I go down, there is some dark areas along the inferior aspect of the portal vein. It goes all the way up to the splenoportal confluence. Now, that's an important information. First thing I need to recognize if it's real or not. So let's look at the coronal images here. On the coronal images, I can see that area which is dark in the portal vein is indeed real. It extends throughout the length of the main portal vein all the way to the splenoportal confluence. If I still have a doubt, I can go and look at the material density iodine images, and there it further confirms indeed that abnormality exists. So now the question is, are there any additional lesions in the liver? And I'm trying to go through this again, and I don't see any additional lesion. I see manifestations of portal hypertension. We go down to the bottom of the liver parenchyma. We did not see any additional lesion. Let's go on the coronal images and evaluate that big lesion in the right lobe. On the coronal images, I can see the peripherally enhancing areas and the heterogeneity within. Probably there is some element of necrosis. Now let's go and look at the material density iodine images. On the material density iodine images, when you compare to monochromatic, what is clear is the true definition or the margin of the liver. So I prefer to measure the lesion size on the material density iodine images. We will try and interrogate the abnormality in the portal vein. And what I noticed there, that dark signal in the portal vein is not showing any heterogeneity or any avid enhancement similar to the lesion in the liver. So I feel confident that filling defect in the portal vein is a bland thrombus that is managed with anticoagulation. Had it been an enhancing lesion, that will raise my concern for a malignant thrombus. That means the tumor has invaded in the portal vein. That often requires an MRI for further confirmation before we change treatment in this patient. And the material density water or virtual unenhanced images are just there complementing the material density iodine images if I have any additional concern elsewhere in the liver or abdomen. So looking at everything together, we have confirmed there is a greater than 3 centimeter lesion in a cirrhotic liver in the right lobe. That is diagnostic for a malignant lesion, likely hepatocellular carcinoma in this setting. In addition, there is a thrombus in the portal vein, which we have characterized as a bland thrombus or a benign thrombus that can be managed with anticoagulation. So, this is how I use spectral CT images in my practice for comprehensive assessment of patients with chronic liver disease.